Good morning, Jaram, and welcome back to the second segment of this program. Just to recap, we were speaking about how to select an appropriate program if you have a problem with alcoholism or if someone dear to you has a problem. And we have been looking at the various treatment options available. Of course, a lot of people go to their medical professional who may refer them to AA or to further treatment at one of the treatment facilities available. Then there's non-governmental organizations like the New Life Ministries, Rebirth House, Serenity Place, and Heal House in Trinidad. And if anyone needs any further information about these places, they can get the information in the national directories. And then, of course, there's a Substance Abuse Prevention and Treatment Center at Cora Hospital. Now, I know that for women, it is a little more challenging to seek help. It has been my experience that a lot of women will keep the family together if the male member of the household, the head of the household, the husband is an alcoholic or drug addict. The wife are still able to hold the family together, cook, wash, sweep, clean, take care of him as well, and even look after things so that he can go and seek help. But when it comes to the woman going to seek help, it's a different matter. I want to let our sisters there know that I am aware of these challenges because a lot of men will go for treatment begrudgingly at first. Eventually, when they get out, when water more than flour, as we say, they'll probably agree to go. If they are pressured by their employer or circumstances or the police charge them and so on, they will probably go to AA or go to Cora for help. But women have additional difficulty in that alcoholism and drug addiction is more stigmatized where women are concerned. If a man is drunk and misbehaving and so on, the society accept, well, look, that's not abnormal. But if a woman is drunk and sleeping by the shop there on the pavement, that in a community where she's known, can you imagine for a minute? She would be in trouble in that community because women themselves are not very kind to each other when it comes to gossiping. And women are aware of this, so that this is why a lot of women become closet drinkers. They're pressured by stress and circumstances and poor coping skills and low self-esteem, a lot of them, and abuse. They turn to alcohol to help them to cope. And I know a lot of them would try to drink when children gone to work, husband gone to work. They will try to drink and they'll try to get sober before they all come back or pretend, and they will do all kinds of things to disguise the smell, stuff, sweets and dinnerments and all of that kind of thing. But eventually, as the disease progresses, they can't manage to even keep up the charade. And most of the time, family members come and find them drunk and sleeping there and in a mess. And sometimes they are abused because of that, not only by the husband, but by the children. They're ashamed, they're, embarrassed. And they are, and in spite of all of that, they're afraid to still go seek help because it is bad enough for my children and my husband and my immediate relatives to know that, look, I do all these embarrassing things, but for the public to get to know that especially when you live in a community, that's a very difficult thing, let alone leave home and go to Cora or go to one of these places, clearly everyone will get to find out that you're declaring that you have a problem. So these are additional difficulties, and even when they are in agreement to go seek help, now you find all of a sudden the man cannot manage. The husband, he has to go to work. Who will take care of things at home? Who will send the children to school and do the domestic chores and so on? So it's really, really very, very difficult for women. And this is why I'm especially speaking to our sisters out there today that help is available. Thank God, finally now, you don't have to go anywhere. You don't have to even let anyone know that you have a problem because you have these online meetings that are available 24/7. Because as we speak right now, there are some people, there are meetings going on all the time. Because of the time zone, it is evening in probably in England or in New Zealand, and so they're having the meetings and we could access it now. And in the middle of the night, there are some places that now they're having their meetings, in South Africa and all of those places. They have meetings at different times, and there are meetings held during the daytime, I know, in the United States. So that after you finish your work, you just, once you have a smartphone and you have internet, which almost everyone has, even those vagrants now have phones. I've seen a comedy show. I'm sure a lot of you would have seen. Vagrants have phones now too, and and you can get Wi-Fi from hotspots. There's a lot of business places that have guest accounts now that even if you don't have Wi-Fi, you can access the internet. But if you have internet and you have Wi-Fi at home, especially for women, it will work if you have Wi-Fi at home, so that after you finish your chores in the morning, you can go to your meeting in the United States, you can join, and you don't have to put your name, you don't have to put your picture. You can put any sobriquet, you can put whatever nickname you want. And alcoholics and drug addicts do inherit a lot of nicknames. And you can attend, and you don't have to pay any fee, you don't have to sign no form, you don't have to do anything. You just have to get access to the ID number and the password. And I can give anyone who has a drug problem or alcohol problem out there, if you would like to get help from going to an online meeting, you can call me after the program and I will give you the reference information that you can stay at home and you can attend these meetings. And I am telling you, I know people now who have been years sober by going to online meetings. In fact, these were available even before the pandemic. So now there are some instances where you have to go to an in-house program. Okay. For instance, if you are suffering with, if you are, now there are different stages of alcoholism, for instance. There's the beginning stage, there's the middle stage, and there's the chronic stage. There's the dromal and prodromal stage, as this is called. And when you are in the chronic stage, you may suffer with severe withdrawal symptoms if you're trying to stop. Like some people, they suffer with epileptic-like fits. There are some people who hallucinate. There are some people have what you call tactile hallucination. They feel like things crawling on the skin when the alcohol is wearing away from them. And some of them will actually see and hear things. And a lot of people who do not understand think that they are possessed by some demon and will take them to some faith healer and so on to see if they could address it. But that's the reason is because they are in withdrawal from the alcohol use. Now, some drugs could also cause that. Then there's the other classic withdrawal symptoms like the irritability and the nausea and the vomiting and the insomnia and the anxiety and the depression. All of those are withdrawal symptoms. So if you are in the chronic stage of alcoholism, you need to be detoxed under supervision. And for those, they would need to be taken to either Ward 1 in San Fernando or St. Anne's Hospital in Port of Spain or Ward 8 of the Port of Spain Hospital. They need to be detoxed under supervision, and then they could be transferred to another treatment or drug facility or even discharged home to go to Alcoholics Anonymous meetings. So that I'm saying this to anyone out there, if when you stop drinking, or if the person you are interested in helping, if they are over 40 years of age, if they have severe withdrawal symptoms, that is, they hallucinate or they see and hear things that are not there, they have tactile hallucinations, they suffer with blackouts and all of that, then you may want to take them to an institution for detox. If they don't have all these severe symptoms, then they can consider going to Alcoholics Anonymous, Narcotics Anonymous, or they can also be treated in an outpatient program. Because I know a lot of people cannot get the time from the job. They do not want to give up their job because that's their lifeline to go into a in-house treatment program. There are in-house treatment programs. The one at Cora Hospital is normally for 6 weeks. The one at New Life Ministries generally 3 months with a follow-up. All these programs have follow-up for sometime up to 2 years, where you attend once a week. There's the Heal House that has an in-house program. Rebirth House also have in-house programs, and these could vary from 3 to 6 months. There used to be one at Piparo that ran for up to 9 months. Now, I want to say from research has shown it doesn't matter the length of the program. What really matters is the person's level of insight and motivation for recovery. Because there are some people who could just go to the AA meeting and they can stay sober for years and years. And I've seen people now over 50 years sober in Alcoholics Anonymous by just going to meetings. And there's a few who, after some incident, decide, look, this is it. This is the last straw. I am going to stop. And they are able to tough it out and do it on their own. But that is very few and far between. And I know a lot of people would like to do that. Initially, they would like to do it on their own. And a lot of people struggle to do that on their own for years, right into the gates of hell and insanity and death even, without wanting to go out and seek help. But I want to talk to our brothers and sisters out there. Alcoholism and drug addiction is recognized as a disease. It's not a bad habit. It's not a moral issue. It's just like hypertension, just like diabetes. If you're sick, you need to go and get help. Nobody should be angry and upset with you. But we live in a society, yes, I am aware of, and I was speaking to that earlier, of the stigma associated with alcoholism and drug addiction. Because it is in the opinion of the public out there, that nobody held you down and forced you to take the drink, pour it down your throat. You went for yourself and you got it. And how they can't understand how a educated, intelligent man like you, or a woman who grew up in such a good, decent family, could go and be so foolish now as to continue to do this, especially after bad things have been happening with you. Well, it is not for lack of knowledge or wisdom. The people know. I was there. I've been there, done that. It is not for the lack of knowledge. It is not for the lack of effort or even motivation, but it is for the lack of support and the fear of seeking that help that keeps a lot of people out and away. And then again, we were socialized, by our parents, the people around us, to become self-sufficient. Every one of us, you remember when you were small, your parents would say, boy, you're old enough to take a bath for yourself now. You're old enough to wear your clothes and comb your hair. And so we strive to become self-sufficient. And then we come up with this drinking or drug problem. And we can't help but bring all our resources, all our strength, all our insight, all our motivation to bear upon it without succeeding. And eventually, hopefully, some of you listening to this program will have gotten over those things and decide, look, nothing is wrong. Okay, you don't want to go to AA meeting, you don't want to go to Cora Hospital, but there are practitioners like myself and others in the community, psychologists, uh, uh, um, psychotherapists, who can counsel you in a confidential manner. And in my case, I have also been using acupuncture, which is a very, very effective method. This is a good option because I know if you went to the psychiatrist and you suffer with the withdrawal symptoms, you might very well get prescribed some psychotropic drug to help to tide you over. Albeit they'll give you the instruction that you shouldn't remain on that for very long. But it has been my experience that, once Trinidadians, we are a little too smart for our own good. We read the label, we read the name of the medicine, and we don't go back to see the doctor. We just go to the pharmacy now and get some friend or somebody to buy it for us, and we keep using it, and then we develop tolerance where we have to this, use more of it and more often to get the effect. And then being an alcoholic or drug addict, we start supplementing the drug with the alcohol. And that is a double whammy. That's a double trouble. That can kill you. And I say that with all seriousness, because when they manufactured a drug, a sleeping pill, they did not test it with people who were drinking. They test it with people who are sober. When you go and take sleeping pills and then you go and drink alcohol or use other drugs with it, it is contraindicated. You may not only drop asleep, you can put your heart to sleep. And you would have read or heard about people who OD. You know what OD? OD is overdosed. That is how it happens when people are not getting the desired effect from a certain amount of a drug and feel, well, they have to take more. And these drugs, they blur your reasoning. I mean, you don't think straight when you use them. So you might not even remember that you took a tablet or you took two tablets already, and you can kill yourself. So that's a serious thing, especially for people who are on psychotropic medication. To be using illicit or illicit drugs like alcohol is extremely dangerous. Okay, so you go to a treatment center. If you're choosing a treatment center, if you have to go in-house, you need to detox. Well, there are the general hospitals, Ward 1, Ward 8 in Port of Spain, St. Anne's, that will detox you from drugs, deal with the withdrawal symptoms, and then you get referred maybe to Cora Hospital or to the outpatient clinic. However, when you're choosing a program, I must say that I have to give compliments to all those non-voluntary organizations in Trinidad who have been doing yeoman service to bolster the national drug treatment effort, because Cora always has a long waiting list. It's the only drug treatment center really we have in Trinidad and Tobago that's set up for that purpose. But because of the volume of the problem, the amount of people drinking and getting into addiction, Cora, even when I was there I had been at Cora since 1988 to 2000 when I was there. Even in those days, we had a long waiting list. And so a lot of people had to be treated in the outpatient program. But a lot of people cannot. They live so far away, Cedars and Point 14, that they can't come to the outpatient program in Cora. So for those, normally we would send them to the Ward 1 clinic on a Monday at San Fernando. But even then, that was very difficult. Now, if a person is living on a drug block, as we say, and you don't have to live on the drug block per se, that is a risky thing if there's drugs available in your community very near to where you are. And probably that's where you were buying it and using it from. So that one of the first things we suggest to people who have become addicted, if you want to stay sober, you have to distance yourself from where it is available. So you have to keep them away from where it is available. But then there might be other people in the same house who are drinking or have drinking and drug problem and who do not want to stop, or who don't think they should stop because you are trying to stop, and or smoking marijuana and all of those things, so that you are living in a very high risk environment. And although you might have tried your best, but because the people around you do not understand, I have instances where a wife is trying to stay sober, but the husband is still drinking and he is insisting that, take a drink. He's not helping her to get better. He's helping her to stay sick. And this is why the family need to get involved. If this person is going to make it, they need to understand the nature of this disease, that you do not continue to enable the person to use or stay sick. So in instances like that, sometimes it is important to have a place where you can take the person out of that environment, at least for a few weeks or a few months, until they can become stable and, strong in their recovery, get on the program of recovery before they could return to these high risk environments. So that those would be factors that would indicate that you need to put the person in an in-house treatment. Otherwise, if the person do not have serious side effects, hallucinations and DTs and all of those things, you may consider an outpatient program. And AA has been successful. In Trinidad, we are very fortunate. We have over 120 AA groups scattered all over the country, in every community. In fact, in the community in which I live, we have 5 meetings now. We have a meeting on Friday night at the Mahasabha School, Felicity Hindu School. We have one on Saturday night at the Presbyterian School, which is nearby. Then we have another one on Sunday evening at 6 at the same Felicity Hindu School. And that meeting has been there for over 45 years now. Every Sunday they meet, holiday or no holiday, whatever. The AA meetings go on, they happen. It's not like other organizations. They are very, very particular about that. That whenever anyone, anywhere reaches out for help, the hands of AA must be there. And for that, every AA member is responsible. So, and then there's another one on Monday, again at the Presbyterian School. And during the COVID, there was one that was started in the farmlands. That is on a Wednesday night. And then there's in several other communities. Endeavor has a meeting on Thursday. There's a meeting at Warrenville also on Thursday. There is at the Shagona Senior Comprehensive on a Tuesday night. And so there are meetings all over Ragunanan Road on a Tuesday night. There is meetings in Freeport on a Saturday evening. And there's not only in Central, in South on a Monday night in Debe, you have a meeting, one on Saturday night at Canaan School in South. And so if you want to get this information, you can contact me. And there's a little pamphlet that is given out by Alcoholics Anonymous, the General Service Office, which is located near the BC factory in Central. And you can get, there's a pamphlet called Who Me, which has all the list of the AA groups in Trinidad and Tobago, and even contact numbers that you can get in touch with people who could give you further assistance. So that the AA meetings allow alcoholics and drug addicts who still want to be with their family because of the circumstances, they want to stay with their job, and they can go to the work and they can come to the meeting in the evening. The meetings are usually from 7 to 8:30, in some cases 9 o'clock. They can go to the meetings and they can get up in the morning and go back to their jobs. So that works well for people who are working and so on. But whatever program you decide to go to, it is always good to research the program, because it is going to a place just to be kept away from the drugs has definitely, it can help, but has not really translated into permanent recovery for a lot of people. Because a lot of people go to jail because of some crime or drug use, and just being kept in prison did not really translate into recovery, because a lot of them, when they came out, the first thing they did was go and take a drink or get back to the drugs. You know, staying away from it or be preventing from be using it without a program. Abstinence alone will not keep a person away from drug use. They have to learn how to live with it, not only stop, but stay stopped. And so that you want to go to a program that is really populated with a staff that is professional, people who are trained. And yes, I know that people who are in recovery, they make very good counselors, but being in recovery alone, to my mind, is not sufficient, because I've seen instances, and there's research, where with all good intentions, sometimes these people in recovery can do some harm, more than good that they are doing. So that it is important that the treatment facilities have people who are experienced as in working with drug addicts and alcoholics, and they also have the training. So we will speak more about this in future programs. I want to thank all of you who joined us this morning. and listening to the program, and to let you know this program is going to be posted on Facebook and YouTube as in a few minutes, and it will also be replayed on the same station at 10 p.m. tonight. And if you have questions, you can reach me at 671-3040, or you can text me with your questions at 768-5925. Thank you for joining us, and thank you for listening. I want to thank Radio and TV Jagriti and the staff, especially for the very inspiring program that led up to this one, and to thank the Mahasabha generally for giving this airtime free of charge as a community service. Thank you again, and see you all next week, Thursday.